Speaker, I have 43 slides. So, okay, I'm going to talk about something that we did with clinicians at the American Society for Colposcopy's annual meeting. And just to give a brief background, I come from a field of image retrieval. We're trying to find images that are similar to a given patient, perhaps. And there's a lot of talk about that, so we want to explore its practical use, and this explores that. So, CBIR, content-based image retrieval, what is it? It basically is finding things that look alike. Now, we know in medicine things that look alike don't necessarily mean the same disease. So there is that caveat, but we're trying to find things, and CBIR has been out there for a while, claiming to support and maintain and manage these large imaging data that's acquired in all health centers these days. But there are over 5,000 articles in PubMed alone, let alone the engineering journals. But we don't really see any impact in healthcare today. And the question is why? And we just want to find out, because I'm a researcher in that field. And so we did an usability study, and the background of this is Survegram Finder. We have a project with the National Cancer Institute where we have over 100,000 images of cervigrams. The cervigrams basically are photographs of the uterine cervix taken during a normal gynec exam. And the region is washed with acetic acid. And if it turns white, aceto-white, whitening, it reflects that there's a possibility of HPV infection, the human papillomavirus being the single cause of cervical cancer. Now, it's a different thing that you're got to go through another study to figure out what type it is and will it lead to cancer. But they were trying to map visual appearance to the potential for cancer. And so we built a tool to find images that look alike, that have the same lesion, the same degradation of the lesion and so on, with the hope that it'll be useful in the field. And that's the lesions that have been marked by an expert. And that's the tool, what it looks like. So on the left is the query image. The user has drawn a region. I don't know if that's how the region has drawn a region of interest. And these are the matches that we have found in the collection that have a similar characteristic to some amount of color, some texture, some location with respect to the os, that's the entrance to the uterus, etc. And the hope was it would be, of course, easy for them to use it. And so we went to this annual meeting of the ASCCP, and there mainly the attendees are practicing gynecologists, colposcopists, and nurse practitioners, among other experts. And we had them answer questions for us. So basically we were trying to find out how much computer use they've got, what is the status of the electronic health record in their practice, and whether they're familiar with the images. They're looking at these in their colposcopes, but they don't necessarily, after the fact, go back and look at these images in their workstations. So 95% were basically involved with clinical care, and only 5% were really in the education field. A large population maintains only paper records, and that's the strange one. We don't know why that, but there's room for growth here. And a small fraction to printed images for patient education. That was interesting. There is a need out there to capture this as a record. They're marking these lesions on paper right now. And we also had a real study where people used our tool. It was an hour-long session. We had them think out loud what they thought about the tool, and we were encouraging them to voice their thoughts. And we had follow-up questions before and after the thing that were compared against what they had opinions about this idea of finding similar imaging, finding similar patients before the fact. The idea was, well, a large percentage wanted to mark the images, and they want to be able to take them from one healthcare center to another, and they would use image retrieval if they could in education and research and clinical care. We had these various criteria that we're using for effectiveness. The amazing part was a large percentage lacked basic computer skills. They used a browser and they made it out. But when you put a new system before them, these icons mean nothing. They could not connect between browsers and other things. And of course, the idea of a visual image retrieval. I can find something that looks like this, and translating what they normally think. They know a lesion looks like something else, but making that into a query for information retrieval was alien. And that's a lesson to us as developers and researchers to translate what we do in the lab to something that can be used in the field, in the standard workflow. And of course, one interesting comment was they want to use it for quality control. A senior clinician wanted to use this as a part to query the performance of junior or other residents perhaps in the program. So you should interact closely with clinicians, it's very important, and be aware of the limited computing capability and be very aware of their workflow. Thank you.